This video is for artificial lash application, like the strip lash application. And we are going to start this video as if we first got to work. So when we get to work, the first thing we always do is wash our hands. So we're going to go to this sink and wet our hands. We are going to find the liquid hand soap, get a coin size amount, and rub our hands together down to our wrists. We're going to wash the back of our hands down to our wrist. We're going to wash our fingers. We're going to wash the backs of our fingers. We're going to wash our fingertips and nails. We're going to wash between our fingers and our thumbs. We're going to wash our thumbs and our wrists. Of course, we're going to do all of that for a minimum of 20 to 30 seconds. Then we're going to rinse everything thoroughly underneath water, and when we feel like that's ready and clean, we're going to grab either disposable paper towels or a clean towel to turn the faucet off. We'll completely dry our hands off. If it's paper towels, it's going in the trash. If it's now a dirty towel, it goes in a closed container until time for laundry. And then we're going to find our hand sanitizer, 70% ethyl alcohol, and we're going to sanitize our hands. And then once our hands are sanitized, we're going to prepare our space for our client who is coming in for her artificial lash application. And what we want to do is disinfect our workstation, bed, and equipment using a disinfectant wipe, following manufacturer's instructions. We will dispense products needed for the service. We're going to prepare disposable portion cups for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup tray. Or we can remove product with a disinfected or clean single-use spatula, close the lid to the product, and set the portion cup tray on the tray. We're going to place disposable table paper on the disinfected bed, and if you don't have that, like I don't have that, you would then prepare your facial bed like you would with your sheet. So you're going to use a fitted and a flat. You're going to place a towel horizontal at the top of the bed. All of that's clean, of course, and you're doing that on your disinfected bed. So everything else will be the same. You would then need to greet your client for client consultation when they arrive, but I'm going to show you the tray that I have gone ahead and prepared, obviously to expedite time for my client upon arrival. I'm going to make sure that I can always save time. So everything is set out and ready. We have cotton rounds, we have 2x2s and 4 squares. We have a makeup remover here. We've always got water. We have our artificial lashes with lash glue, tweezers, and small scissors. We have wooden sticked Q-tips here to help us apply the glue to the lash. We have a set of gloves because this is always going to be a gloved service. And then we have some disposable mascara wands, a couple different kinds, to comb out the lashes. So we are set up for our client. We're just waiting for their arrival, and then we would go and perform that client consultations, which is what we're going to do now. Just noting that when I came to work, obviously I just washed my hands, set everything up. I would always be approaching my client for the consultation with clean hands. I will be washing my hands again for the service. I just like to notate that in every video that my hands would always be clean. So I'm going to greet my client and escort her to the work area, and then I'm going to assess the client's style, determine the client's preferences, and assess the client's needs. I'm going to assess the client's skin by performing a skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, for example, lice, to prevent from safely performing the service. We'll assess the client's consultation form for any medications and products used within the last 72 hours, and we'll consult on any known allergies. We'll consult with the client on any facial surgeries within the last 3 months and if the client is under a physician's care. We'll assess if the client is prone to cold sores or fever blisters. We'll assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. We'll assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. If the client is free from the above contraindications, we can proceed with the service, which Betty is just fine, and she is hosting a Halloween party, and she wants to feel a little bit more glamorous, so she is getting her artificial lashes put on today, and she doesn't feel very confident doing it. So we're going to help her do it. So let's get her comfortable. so we can get ready. So she doesn't have to disrobe for this service. So I'm just gonna drape my client with a towel, and I'm gonna bring it all the way up to her chin, because if she has clothing on, etc., I just don't wanna make sure there's anything that could get on her, for example, makeup remover, lash glue, anything. So I'm gonna make sure she's comfortable. I have a headband here that I'm gonna apply on to her head to keep her hair out of her face, away from her lashes, so that doesn't interfere with the service as well. And then I'm gonna wash my hands so that I can get going. So I'm gonna go to the sink, of course, once again, and I am going to wet my hands, and I'm gonna find that liquid hand soap, and I am going to wash my hands down to my wrists, and I am going to wash the back of my hands down to my wrist. I am going to wash my fingers, and I am going to wash the back of my fingers. I'm gonna wash my fingertips and nails. I'm gonna wash between my fingers. I'm gonna wash between my fingers and my thumbs. I'm gonna wash my thumbs. I'm gonna wash my wrist. I'm gonna do all of this washing, interlocking movements, making sure I get everything really good and clean. And then I'm gonna thoroughly rinse it off. When I feel like I've rinsed off all of that soap, I'm gonna grab either disposable paper towels or clean towel to turn the faucet off, completely dry off my hands. The paper towels go in the trash. The dirty towel goes into a closed container until time for laundry. And to finish my hand wash, I get my hand sanitizer with 70% ethyl alcohol, and I sanitize. And I'm making sure right here that I've got everything really, really good and dry, because I have to put on my gloves now to perform the service. So the first thing that you're gonna do when you start your service is you're gonna remove any eye makeup that they might have on. So I'm gonna get my cotton rounds with some eye makeup and get that process started. Every woman is a little bit different. I think any woman that would like to wear artificial lashes on a regular basis, or even for a party, tends to have a little bit of glam in them. They really want to stand out, or maybe it's a once in a lifetime thing. That's fine too. This particular client, Betty, does like a little bit of glamour, so I am going to take the time to make sure I get all of this makeup off, because she's got quite a bit on, and then she can redo it then once she's got her lashes on. She's going to figure out her next move. So what we're doing here is just taking a minute to take off what her look is right now, so that we can get this nice, beautiful strip lash on. And then I'm going to take a minute to dry everything nicely, because you don't want it wet if you're going to be putting lashes and lash glue. You need it to be nice and dry so it'll stay. So with your artificial lashes, when you look at them, there actually is a right side and a left side. And usually, like if you've taken it freshly out of the box, which you would, you'd be using a brand new set, you will realize like it's just like your eyes. So there would be a nose in the middle. And so the short side is going to be on the inside towards the nose, and the long side of the lashes is going to be on the exterior of the eye. So you're literally going to have a right and a left. So when you are measuring and applying it, there is a particular side that you're going to be looking for to apply to your client. So I'm going to measure the right side first, and what you want to do is not put any glue on it. You just want to take it with your fingers, have the client close their eyes. Okay, Betty, will you close your eyes? Thank you. And then you're going to line it up as close to the lash line, and you're just doing that visual assessment. Oh, is it too long? Is it perfect? Is it too short? Do I need a different size? Like, okay, so mine actually beautifully lines up almost perfectly, but I'm going to pretend like it's too long, which happens a lot. And what I would do is then hold with my fingers the excess amount that's too long, and that would be on top of my fingers. And then I would grab my little scissors, which are right here, and I would trim that excess amount off on the top of my fingers. If I was to trim underneath my fingers, I'd make it like way, way, way too short. So just trim that excess off, and you're going to take that excess and put it in the trash. Then you will flip your lash over, and it will be really easy to see. You'll know that's already a little sticky just from being in the box to hold it in the box. And then you're going to apply your lash glue. So you're going to get your lash glue, and you're going to take your lid off, and you're going to apply a little bit of the glue to the end of a wooden stick Q-tip. And look, there's a little piece of dry glue that I'm just going to take off and throw in the trash. So we would squeeze some out and apply it to the end of our just like applicator here. And then you would take the glue and you would apply it to the lash all the way corner to corner of that other underside of the strip lash. Sometimes the glue can bubble or be thick, and you just need to know that you're going to spread it out evenly along the edges. I mean, all the way edge to edge. Then you're going to flip it over, and you're going to grab your tweezers, because your tweezers are going to be what you're holding the lash strip with. And I usually hold about midpoint. And then I'm going to take it into the eye, and I'm going to put it as close to the lashes as I can. And then I'm going to press the outer corner, and then I'm working my way in. And you have a nice little couple seconds here to get it. You can kind of scooch it toward the very, very end of her, as close to the lashes as you can, because you really want to incorporate her lashes with the strip lash. And then you will wait, you know, maybe 4 to 5 seconds. So sometimes I wave my hand. You could have a little fan. It just speeds up the drying process. I also like to have my clients open their eyes, like they do like a little blink test to make sure there's nothing that's irritating them, that they're going to feel the lashes on them, but my goal is to make sure there's no glue or anything anywhere it's not supposed to be. And then I can move on to the other eye. So now you're going to repeat the process on the other side. So I know I have the left strip here for the left eye. The first thing I'm going to do, I'm not putting any glue or anything. I'm just using my fingers, and I'm doing that measuring step. Pretty much guaranteed if it was too long on the other side, it's going to be too long on this side. So I'm doing that same kind of like track test to see, and we know that it fits her, but for the video purposes, I'm going to show you how I would trim it. So I would take that little excess bit that's too long, and then I'd grab my scissors, trim above my fingers, trim it off, throw it in the trash. Then I'm going to flip it over so that I can apply the artificial lash glue to the underneath part of the strip lash at the very end. So I'm going to take one of my Q-tips, I'm going to take my glue, I'm going to squeeze some glue out on my Q-tip, and then I'm going to apply it literally corner to corner, taking my time, spreading it out, nice little thin layer, evenly, no bubbles, no blobs of glue. And if you feel like you get a blob, you take the Q-tip and you wipe it off, and you toss the Q-tip anyway. So we're going to flip it over now, and I hold at the center, and then I go line it up as close as I can to her lash. then I can start my press. Pressing from that outer to the inner. And I give it that, you know, the time that it needs to where you feel like it's dry. If you have a little fan, like I said, you could hold that there to help. I let her open her eyes, do the blink test, see how she feels as far as the glue goes. And if you see any parts coming up, you can always add a little bit more glue. And then I always present to the client and show them how amazing they look. And they're just like, oh, look at that. It's so perfect, so pretty. And that's how quick and easy an artificial lash application is. So at this point, what you want to do is remove your gloves. This was not, she didn't have to disrobe for this service, which was really nice. So once you get your gloves off, you will, you can take her headband off, obviously, and help her up. And then you'll be able to get her checked out. So let's talk about what happens to finish out this service. So of course you're going to go over maintenance and aftercare. With these, you just need to make sure that she understands how when she washes her face, she can simply remove them. She can throw them away, or if she does want to keep them for 1 or 2 more wears, they don't last that long, she can. You just have to show her how to apply it and how to add glue and how to, etc. If she wants to. But this is a pretty easy follow through here, and then you'll get her checked out and she can go continue on with her day. Then you got to go back to your room because you have to prepare for more clients that are coming in. So what you want to do would be to go back to your work area, and you're going to throw away or discard any single-use items. For example, those Q-tips that you might have used to apply the glue, disposable gloves if you haven't already, etc. You're going to find those implements that you used, and you did use implements because you used tweezers and scissors. Put them in a closed container labeled to be disinfected. All of the bedding, sheets, towels that you might have used, drape, you're going to go ahead and put them in a closed container for laundry later. And then you're going to find a proper cleaning agent and read manufacturer's directions, follow manufacturer's directions for mixing and usage. You're going to wipe down your workstation and area to remove any debris. Then you need to identify a disinfectant that is bactericidal, virucidal, fungicidal, and EPA approved for use in a salon setting, which means you're going to need to get another pair of disposable gloves to put on because you have to wear gloves when working with that product. You're going to follow manufacturer's directions for mixing and or using appropriate aerosol disinfectant. You will disinfect the electrical equipment stored in a clean area separate from other implements. You can then remove your gloves and throw them away. And final step is that you have to wash your hands one final time. So get to that sink, wet your hands, get that coin-sized liquid hand soap, and you're going to wash your hands together down to your wrist. You're going to wash the back of your hands down to your wrist. You're going to wash your fingers, and you're going to wash the backs of your fingers. You are going to wash those fingertips and nails. You're going to wash between your fingers. You're going to wash between your fingers and your thumbs. You're going to wash your thumbs, and you're going to wash your wrist. You're going to do all of that interlocking cleanse for a minimum of 20 to 30 seconds, and then you're going to thoroughly rinse everything underneath the water. When you're done properly rinsing, you can grab some disposable paper towels or a towel, turn the faucet off, dry your hands off completely. Paper towels in the trash, dirty towel with the other laundry in a closed container. Get that hand sanitizer, 70% ethyl alcohol, and you can completely and thoroughly sanitize your hands. And when you feel like that you have done all of that, it will now be time to move forward and prepare your work area for your next client that's coming in. So that concludes your video for artificial lash application.